Hello and welcome to this presentation on Advanced Care Planning or ACP and the Quality Improvement QI project conducted at the Rochester Academic Family Medicine. ACP is a critical aspect of healthcare that ensures patients have autonomy in choosing of their medical preferences, especially towards the end of their lives. In this presentation, we will discuss the QI project, objectives, methods, and results, as well as its implications for public health. The long-term goal of the QI project was to have clinic-wide policies and procedures that achieve 100% ACP for patients with Medicare insurance and/or over the age of 65. We begin by identifying the current rate of ACP completion by examining historical EMR data and determining the factors associated with completion or lack thereof. We implemented a Plan Do Study Care Act or PDSA QI project to improve advanced care planning effectiveness with patients. The project involved tracking annual Medicare wellness visits or AMW through the electronic medical record Athena. In the plan cycle, we evaluated AMW visits in May of 2022 for advanced directive presence, copy of AD, and patient wishes. In the do cycle, we informed faculty and residents that all AMW patients would receive a copy of personalized end-of-life planning tool called 5 Wishes or FW, altered AMW templates to include ACP discussion documentation, gave and reviewed 5 wishes with each patient at their annual medical wellness visits from July to September of 2022, and contacted patients who did not return 5 wishes advance directive to determine why. In the study cycle, we used Microsoft Excel to collect and analyze data and obtain data on AMW visits and the level of physician training performing AMW in reference to ACP discussion and documentation. In May of 2022, only 3 out of 31 patients had an advanced directive or AD, and 24 out of 31 patients discussed their wishes. In July through September of 2022, 6 out of 80 patients had an existing AD. 32 patients were given a copy of 5 wishes, but only 1 patient returned it. 48 out of 80 patients discussed their wishes, and the patient wishes as a result of ACP discussions are shown in Figure 1. Of the 32 patients given 5 wishes, 10 patients did not return it, and the reasons are shown in Table 1. We also evaluated AMW encounters completed in July through September of 2022 in relation to the physician's level of training. And the results showed that more complete documentation of the ACP process with attending physicians compliance around 60% and resident compliance around 36%. The results showed that the majority of the patients feel comfortable expressing their ACP wishes. However, many patients did not complete a written AD using 5 wishes, and the reasons for not completing it varied. Future PDSA cycles should examine the utility of a dedicated office visit to discuss ACP outside of an AMW. The results also showed that there is room for improvement in physician compliance with ACP documentation, which could be achieved by increasing the physician education and awareness. Finally, advanced care planning is essential for proactive healthcare, and being prepared helps to ease stress on patients and their families. Improving ACP effectiveness is critical for improving end-of-life care in reducing healthcare costs. By promoting ACP and increasing compliance, we can ensure that patients receive the care they desire and reduce the burden of healthcare system.